Unexplained infertility is the diagnosis given when a couple or an individual suffers from infertility, but the cause is unknown. It's hard enough to struggle with infertility, but having no answers makes it even worse. Imagine what a painful diagnosis that is. Or maybe you don't have to imagine, because unexplained infertility is very common. It's the diagnosis for around 30% of couples seeking fertility care. Now, if you've watched any of our previous videos, you know that infertility affects men and women about equally. However, the lack of male fertility tests means the numbers are even worse for men. It's estimated that 37 to 58% of infertile men have no known cause for their infertility. Without understanding the source of male factors, clinicians are unable to give appropriate care. The limited set of male tests can only detect the major causes of infertility, like azoospermia, the absence of sperm. This leaves the less obvious factors invisible. So how do you treat something without knowing the cause? Well, intrauterine insemination, IUI, is one less invasive treatment option that you often see. This is where sperm is inserted directly into a woman's uterus. But in vitro fertilization, IVF, is considered the most effective treatment for those with unexplained infertility. This is when sperm and egg are combined in a lab dish, and an embryo is then inserted into a woman's uterus. IVF is expensive, but fortunately it boasts a conception rate of about 40%. Now, repeated failed rounds of IVF could actually help you identify causes of infertility. For example, if sperm and egg quality are normal, then embryo development or implantation may be to blame. But undergoing multiple rounds of IVF is a very expensive way to start getting answers. So what other options do you have? Epigenetic testing could help you avoid the cost of multiple rounds of IVF by predicting whether embryo quality will be an issue. If you're struggling with unexplained infertility, check out SEED, our male fertility test that uses epigenetic data to help give you the best chance to get pregnant.